Hi, folks. Today we are navigating the emergency room. I do want to put a disclaimer out there to let you know I'm not a clinician or a medical provider. I do work in a local hospital, however, or have worked in a local hospital. Currently, I work in home health as an admin. I have been an admin, a registrar, and financial counselor for various, doing those various duties for 18 years. And 5 of those were in the emergency room, working side by side with clinicians and doctors and pharmacists and all sorts, EMTs that came in, just all sorts, and just seeing how things, the processes work, and then just understanding how patients would navigate a process. Also on the financial side of things, and outside of our hospital, how people would navigate. So I'm here to pass it on to you. So let's start here. When do I need to go to the ER? Now, the ER to me and to folks that work in the ER is for emergencies. An emergency is bigger than something that can be seen at your PCP or in urgent care. Now, if those folks are closed, then you may have to use the emergency room for something that isn't quite as emergent as you would normally use an emergency room for. So you just have to just discern what makes sense to you for an emergency. So an emergency generally would be something like a heart attack or a stroke, stroke symptoms, or someone having a stroke. Very important to get someone to the emergency room very quickly with those. Generally, you would call 911 and get someone there very quickly so that they can help take care of that patient very quickly. They know exactly what to do. Major injuries, severe bleeding, unconsciousness, maybe even someone that's been electrocuted, hit their head really hard, something broken, things of that nature. So when you go to the emergency room, what you'd want to bring is a copy of or a list of your prescriptions. If you used that facility before, you may have had a change in your prescription. So you do want to have a copy of your prescriptions from your PCP with you at all times. That way you do have that handy, so that they know what you're taking. You also want to have a copy of your insurance card. They may ask you for a copay. They may not. It depends on what your insurance says. It could be $200 deductible, could be $350 deductible, it could be a co-insurance. If it's a co-insurance, it's usually a percentage of the bill. And let's just say it's 30% co-insurance. So a co-insurance of 30% would be, say, the bill is $1,500. It would be 30% of the $1,500 that you would be billed. Also, it's 30% after they take the contract, there's a contracted amount that is taken off between your insurance company and the facility or the hospital. So usually what that does is it brings the amount down. So instead of it being maybe $3,000, it's since they have a contract with the hospital, say MODA has a contract with your hospital, then it would bring it down to $1,500. And then that brings your coinsurance down as well. So that is one of the things that insurance companies do. If you don't have insurance, it doesn't lower your costs. You pay the higher rate. Now, if you don't bring your insurance card, then they will bill you very, very, very quickly, because there is no insurance that will pen the bill, that will send the bill to the insurance company to pay it. And it's all done electronically. It will come right to your home, and it will give you the actual amount of the emergency room bill. So don't freak out. Just call the number on the bill and give them your insurance information, and they will rebill that for you. Also, keep in mind, you may also get a bill from the emergency room physicians that sometimes is a separate bill for the ER doctor. Many times they are contracted with the hospital, and they are not an actual employee of the hospital. So keep that in mind. They will also need your medical insurance. Hospitals offer financial assistance if you need help with your bill. So you may also ask for assistance with that. Do not forget to ask for that if you do need that. You have rights to that. Back to payers. If you are there because of a car accident, you do want to bring your car insurance so that they can bill that car insurance for you. They're not going to need the other party's car insurance. They just need yours, and they're going to probably ask what happened in the accident. It doesn't have to be huge. They just got to put some information in the notes. And then also workers' comp. If you have been seen already somewhere else, you will have a workers' comp claim number. If you have not, and this is the first place you have gone for your workers' comp injury, you will need to fill out a form, and the hospital, you just say, this is the first place I've gone. They will have, in Oregon, it's an 827 form. I don't know if that's called that everywhere else, but it's a form that's filled out that that you explain what happened, and you put everything about your work on there, and the hospital will take care of that for you, and they will file that with the state, and get that moving for you, and get your claim number filed. Excuse me. So the next thing that happens is generally registration will put an armband on you, verify your name and date of birth, and then they're going to take your vitals, your blood pressure. Triage nurse will get more in depth on why you are there and what's happening to you at this moment. Keep in mind, you are there for an emergency problem, for an issue. Maybe it's something that has transpired because of other things that have happened, and this is another piece of the puzzle that does happen. But be aware that the emergency room doctors are not there to take care of all of your health problems. They are there to take care of the emergency you are there for. And they will remind you of that. They will either determine if you need to be admitted to the hospital for further testing, for further care. Usually with the testing, maybe, and then, maybe then you would need a specialist to look in on you and do some more things. Or they would be discharging you from the hospital to go home and then follow up with a specialist later, or your PCP for more care that way. You do want to let them know with what's really been going on, like maybe you've been throwing up blood today. Let them know the emergency piece of it. Let them know I've been having headaches all week, and today it has just been excruciating. Like I haven't been able to get out of bed all day. All week I've been able to move around quite a bit, but today I just can't get out of bed, and this is abnormal for me, and I'm concerned. And then maybe there's been some other things you've had with that. Anyway, you sharing the progression of something, or sharing what actually made you come. What is the emergency of these symptoms that brought you here? Like my blood pressure is usually normal, but the last 2 days it's been 190 over 120 or something like that. I mean, it not to scare people, but it's very unusual. Something's very wrong here. That's why it's not urgent care material, right? So another thing I wanted to mention is if you do get medication from the emergency room or as an inpatient at the hospital, they are not, it is not medication you can refill. This is only medication to get you through what you need to get through. You do need to then go to your PCP or your specialist outside of the urgent or outside of the emergency room and outside of the hospital and get that refilled. The doctors at the emergency room and at the hospital are not everyday doctors that will see patients on a regular basis. They are rotating doctors. They are not doctors that will see you on a regular basis and that have returning patients, if that makes sense. They do not have patients in that way. Same with urgent care patients. So the only ones that will do prescriptions are the ones that that see patients on a regular basis. So please keep that in mind, that you will need to refill with your primary care doctor or your specialist when it comes to medication. So allow time for that. I did want to leave you with some thoughts about how to stay out of the emergency room. Now, emergency rooms, I mean, I'm in my 50s, and so I didn't use an emergency room for myself until probably a couple years ago. And everyone's different. Everyone has different health reasons that they'll have to use it. But it's important that we use our primary care doctors efficiently. I know it's not fun, and it's maybe we don't always get the answers we want, but that's another navigating a navigating video we will do. But make those yearly appointments with your primary care doctor. Get those physicals. Get your eyes checked. Get your teeth cleaned. Do all those preventative measures so that you don't have abscesses, you don't have problems with your eyes. Those are being checked. You are getting your gynecological visits. You're not having problems with your breasts that you're getting lumps. You're getting your mammograms. All those things. Just get those preventative measures done for yourself. If you do have chronic illnesses like high blood pressure, or you have diabetes, make sure you are checking in with your doctor more regularly, maybe every 6 months, or maybe it's every 3 months. And that way you're able to keep your medication on track. You aren't letting those expire. You're taking those regularly, because it's when we're not doing that we end up having to go to the urgent care. And if they can't take care of us because we're in a bad way, we're going to have to go to the emergency room. And that just causes more havoc for our body, time off work, and we don't feel well. And that is not good for us at all. So it's easier to use our primary care doctors. They're cheaper, it's smart, and it's easier. You can even do, for prescriptions or just a check-in, you could just do it virtually. So think ahead, get it on your calendar, make it easy, do it like right before you get off work or first thing in the morning. Just get them done. It's maintenance like on a car. So, excuse me. So anyway, thanks for navigating the ER with me today. And remember, you don't have to navigate these things alone. So we'll see you for the next one. Thank you. Bye.